Our next speaker on water quality and safety in hospitals is Ms. Payden. She is the Regional Advisor for the WHO for Water, Health and Sanitation in the Southeast Asian region. During her term in the WHO, she has assisted several countries in the Southeast Asia region to introduce water safety plans. She has supported countries in strengthening the management of healthcare waste through capacity development, piloting of model medical waste management systems, and formulation of guidelines and policies. She has also supported the countries in addressing climate change impacts on health. Before joining the WHO, Ms. Payden worked for about 13 years in the Ministry of Health at Bhutan, where she spearheaded the government's program of providing drinking water and sanitary facilities to the rural populations. Ms. Payden, thank you for agreeing to come and speak to us on water quality and safety in hospitals.
First of all, I would like to thank the organizers of this event, CMC Vellore, for inviting me to speak at this very important hospital safety conference. And I'm indeed really deeply honored and privileged to be speaking in front of you all. Now, my topic will be on water safety in health facilities. And you know how important it is to have safe water, not only in health facilities, but any kind of settings that we live in. Because water, we cannot live without it. But we cannot live without water, but if the water is not safe, again, you are at risk of being sick or getting killed or to die. And safe water is very important because if you do not ensure safety of water, there could be a lot of toxic elements, microbiological pathogens in safe water, and therefore the safety of water is very important. It is not just important to have quantity, but safety is very important. Now, sanitation and hygiene are again huge contributors to this problem of waterborne diseases, because you may have safe water, but if you do not practice safe hygiene, if you do not have proper toilets, proper sanitary facilities in any kind of setting, again, that creates a lot of risks to the population. And of course, in health facilities, it creates a lot of risks to the patients and the caregivers. You may know that WHO has been issuing drinking water quality guidelines since 1958. And earlier, WHO used to issue international standards. And these water quality standards were followed by all the countries without any modification or any adaptation at the country level. But later on, these standards could not be applied directly. People realized that it could not be applied directly to any country because of the many other factors, local conditions that exist. And therefore, WHO started issuing drinking water quality guidelines. And then countries where it was left up to the countries to adapt these guidelines and develop them into national level standards, quality standards. Till 2004, WHO has been advocating and promoting with countries to test water, because that is the only way to ensure that to see whether your water is safe or not. But then again, when countries were implementing this testing of water qualities, they found that there were a lot of difficulties, and then WHO went into introducing a new concept which is called water safety planning. And now, as I've said, despite testing water by different countries, many of the countries in many of the countries, waterborne illnesses still occurs, despite testing water. And then outbreaks also show that we cannot just rely on water quality being tested. We need to do more, because output monitoring, when you test water quality, it is mainly monitoring the output of the whole drinking water system. And by the time you get the test results, it is too late or too little. It is too late, because people have already consumed the water and they have already fallen sick if the water is contaminated, or they would have died. So I would like to demonstrate the problems with output monitoring, which is mainly testing water. Notification comes too late, and this is an example. For example, now your drinking water is, your water becomes contaminated, and then you are testing your water. The water sample has been collected and given to the lab, and in between the water is consumed by somebody, and by the time your test results come in, somebody would have already had that contaminated water and fallen sick. So the results when it comes becomes too late, because you couldn't have saved that life. And again, another problem with output monitoring is that testing and standards are very narrow. For example, for microbiological, looking at microbiological risks, we look at E. coli, which is an indicator bacteria, but there are many other viruses and many other bacteria which could not be detected by testing. So therefore, the testing of E. coli becomes very narrow, and other organisms would go undetected. And again, you have to invest a lot in testing water. You also need a lot of people, you need a lot of money to buy testing equipments, buy consumables, and so many things. Now, because of this, so many issues related to water testing and output monitoring, WHO recommended to go for input monitoring, that is measuring parameters that show that the system is functioning properly. And then the testing is only used as a verification that the system is working. And therefore, in 2004, WHO introduced the water safety plans, which is basically a risk assessment and risk management approach for ensuring water safety. Now, in simple terms, water safety plan is a way to check that the water that is consumed is safe. For example, if it is in a community, we look at the water source, like what we heard from air quality. You have to try to prevent contamination at the source. So we look at the catchment of the water source. We go look at all the distribution system, the treatment plants, until it reaches the consumer, till it reaches the glass. And therefore, if in that process we identify and we assess all the risks, and if we find that there are some risk areas, we try to manage that and ensure that the contamination does not reach the consumer. So that is called water safety planning. It is a risk assessment and risk management approach. And the water safety plan approach could be applied in a village water supply, in a city water supply, in a hospital water supply, in a school water supply. So basically it can be applied to any kind of drinking water systems, including a hand pump or a rainwater harvesting. And then, as I've said, it is checking the whole system and ensuring that nothing goes wrong in the system. Now, the steps for developing a water safety plan, it is not rocket science. It is very simple, very easy. We need to have some support from the management as well as dedicated people to do such water safety planning for any kind of setting. And it mainly involves description of the system. You need to know what kind of a system your hospital has. If you are from a hospital, you need to know what kind of water supply is entering into your hospital campus, what kind of treatment units are there. If the water supply from the municipal is supplied to the hospital, and you have to discuss with the municipal to know what kind of water is supplied to the hospital. And if you think that the municipal water is not adequately treated, then you may need to put in additional treatment units at the hospital level to ensure that the water that is supplied to the hospital is safe. So basically you need to know what kind of system, water system you have, what kind of treatment units within the hospital campus you have, what kind of other systems such as sewage systems, recycled water, all these have to be described, and you need to know the whole system. Then you assess it, you have to identify the hazards, then determine the control measures to reduce the hazards, and then you prioritize which is the most highest risk that is going to affect your water supply. Prioritize that, and you have to address those risks. And then you go on to monitoring, on verification and auditing. So it is a basic tool of risk management. Now, why water safety in healthcare facilities is important? Particularly for health facilities, it is important because the drinking water in the hospital setting is often independent from the public supplies. So some may have separate supplies, some may have water supplies coming from the public utilities. But then after the water meter, it is the responsibility of the hospital management to manage your own drinking water system within the campus. And therefore, the management has to ensure that whatever is supplied within the setting is safe. And then again, in hospitals, you may have supplementary water supplies. Some may have your own underground bore wells or tube wells or rainwater harvesting, which you construct in your hospital setting to supplement the water which is given by the municipal corporation. And then I also heard that CMC has a waste recycling unit where they recycle the sewage from the CMC and they use it for maybe flushing and other non-drinking purposes like gardening and all that. So if those kind of systems are already there, then we need to also ensure that the different systems within the hospital or the health setting is carefully labeled, because sometimes there could be chances of cross-connection between this safe water and the unsafe water. So these have to be known by the management. And then many connections within the hospital system. There could be a huge hospital could have many water supply connections, as I've said earlier. There could be cooling towers, boilers, medical devices, wastewater system, your drinking water system, your recycle water system. So many connections would be within the hospital setting, and that makes things more complex. And then vulnerability of patients. Patients are coming to seek medical care within the hospital, and therefore their immunity is quite low, and they would need special drinking water for different purposes within the whole hospital setting. And then some specialized services like renal dialysis and all may require water quality which is much higher than what WHO drinking water quality guideline prescribes or what the Indian government standards are. So for certain services you may need very high quality water, and therefore if you do not ensure that that safe water is being supplied, the patients' lives could be at huge risk. And then many water and sanitation, like many of the hospitals and health facilities, especially small facilities, somebody was talking about hand washing, and in some facilities they do not have water to wash hands, so you cannot talk about hand washing to them. While in some they have good water supply, but people do not practice. So there are behavioral changes issues as well as other issues that exist. Now, some of the other issues which are faced by hospitals is intermittent supply. I don't know how your hospitals are, but in some parts of the region, like developing countries, they do not have continuous water supply, and therefore hospitals have to store their water in containers, and this leads to a lot of problems. Hand washing facilities are not adequate or not located in convenient locations near toilets or near where patients are checked by doctors. Insufficient toilets, lack of maintenance of toilets is another problem, especially for the patients and their caregivers. And there are also problems with monitoring of water and sanitation services in health facilities. And then poor waste management, which I think we'll hear from our next speaker. Now, what are the hazards, water quality hazards in a hospital setting? Some hazards could already come from the external water supply, but there could be some hazards within the hospital itself which could be introduced in the distribution of the water supply system. Some of the hazards are like enteric pathogens, fecal contamination through faults in internal plumbing system. Like if your internal plumbing for sewage and for your drinking water are not labeled properly, and when somebody is repairing something and they could by mistake connect the sewage plumbing system with the water plumbing system, and there could be cross connection of sewage into drinking water. These are some of the very minute mistakes but has a big impact. Ignorance. And then there could be also environmental organisms. We heard again in the air quality presentation, Legionella and Pseudomonas, which could grow in the distribution system. So Legionella is not what it is. It grows in the water system, but the exposure is through inhalation, and this is quite common in hospital settings because of different issues. And then there could be also chemical contamination in the water supply, mainly due to leaching of some unsuitable materials which are used in the plumbing system of the drinking water, such as if lead joints are used, it could leach into the drinking water system. And then poor sanitation and hygiene are another few hazards which could occur in the hospital setting. And now I've tried to identify some of the major risks in a hospital setting. Now, when the water enters into the building point of entry, there could be again risks introduced when the water enters the hospital building. It could be microbes or chemicals from different activities. And then if there are private sources, again there could be some other risks there, chemicals and microbes. Water piping, again, as I've said, if we are not careful with the water piping, and when repairs are done, if there are mistakes in joining the pipes, then again there could be cross connections, corrosion from the water pipes. Again, many hospitals, we have to store water either underground or on the roof, and there, if the water storage tanks are not covered properly, animals could drop their excreta in the roof water tanks. In underground, again, if the water storage tanks are not covered properly, mosquitoes could breed, and then these days huge dengue cases everywhere all over India. So these are some of the things which we have to be cautious about. Mosquito breeding, corrosion from the tanks if the tanks are made of iron or other materials, and then hot water piping, as I've said, then growth of some pathogens, environmental pathogens. And then within the hospital system, there are a lot of fire hydrants, devices, and if backflows are not provided in these devices, then the contaminated water from these devices could flow back into the hospital water supply system, and this could cause another contamination. So there's a huge lot of things that we need to look into to reduce the risks in the hospitals. And there are also cases where outbreaks have been reported in hospitals. Unfortunately, from our part of the region, our documentation, our research is very poor. So we do not have any case studies or any figures recorded from our hospitals in our region. But from other countries, they have reported cases of Pseudomonas outbreak in hematology unit. And this, they found that it was mainly due to contamination of water samples with this bacteria pathogen. And in Germany, they also detected an outbreak of Legionellosis, mainly because of the cold water system. They could not maintain the water temperature properly, and because of that, the pathogen grew in the cold water system, and these were inhaled by many of the patients, and some even died. Now, there are a lot of tasks to be performed if any one of you is interested to develop a water safety plan in a health facility. There are several tasks which you can also look at into the WHO website. There's a book on that. If you're interested, you can look at those documents. And now, for water safety, I suggest that any kind of health facility, you should try to set up a water safety plan team. And this could be even linked up with the infection control, because water safety, sanitation, everything, we make interventions there mainly to reduce infection in the hospital. And therefore, you could look into forming a water safety team with people from all different faculties like nursing, physician, maintenance is very important, cleaning, housekeeping. So all of these could come together into a team, and then you can look at water safety plan, developing a water safety for your hospital. And I think most hospitals have also, or the state might have disease surveillance systems. You could also look into having a disease surveillance system for your own hospital, and then mainly to detect outbreak of diseases, early notification, and also assessment of responses and putting in efficient monitoring systems in place. And this could be integrated with the water safety planning and monitoring. And it will go a long way in reducing mainly waterborne and water-related diseases within the hospital system. And there are several resources published by WHO. You can go into that. If you are interested, you can contact me. My email is payden@who.int. So if anybody is interested, this is just an introduction to the water safety plan concept. And I have so many things to share, but we have a very limited time. And if somebody is interested, you can contact us, and we could further assist you in developing water safety plans for your own facilities. It could be any big hospitals, small hospitals, rural health facilities, or any kind of setting. Thank you very much for your attention.